हेलो एवरीवन, वेलकम टू आरोग्य फिजियोटिप्स। आरोग्य फिजियोटिप्स में आपको बहुत बहुत स्वागत है। आई एम डॉक्टर दिलप्रीत and in today's video I'll be talking about a very common condition called hernia. So hernia is a condition where an organ or any other fatty tissue, it squeezes through or protrudes through a weak spot in your abdominal cavity. So mostly people with weak abdominal muscles suffer from this condition. When they strain their body too much, part of an organ or a fatty tissue protrudes through the abdominal wall. It leads to the formation of a sac-like structure which you will feel on the outside of your abdominal cavity. So hernia can be of different types, but the two most common types of hernia are your umbilical hernia or the abdominal hernia and the inguinal hernia. So the umbilical or abdominal hernia, as the name suggests, is when a part of your small intestine protrudes through your tummy very close to the navel. So this is most commonly seen in younger children or babies who don't have a well-developed abdominal wall, or it may also be seen in women during or just after pregnancy, because during pregnancy, as the stomach size increases, the rectus abdominis muscle present in the front of the stomach, it also stretches and expands and it separates. This condition is known as diastasis recti. This creates a weak spot in the front through which an organ can protrude. The second one, common type of hernia, is inguinal hernia. So here a part of the small intestine protrudes through the inguinal region or the groin region. This is most commonly seen in males. The other types of hernia could be an incisional hernia, as the name suggests. You have an abdominal incision because of surgery, and before it has healed properly, you do a lot of vigorous exercise, because of which a part of your organ or your small intestine can protrude through that incision. The other type of hernia is femoral hernia. So femur is the thigh bone. So close to the thigh bone, in the inner thigh, if there is protrusion of an organ, that is femoral hernia. The causes of hernia. One of the causes could be congenital, that is a child is born with it, because like premature babies, underdeveloped muscle in the abdomen, it could lead to protrusion of an organ. But most commonly, hernia occurs because of combination of straining your muscle and weakness of the muscle. When both of these occur together, that is when hernia occurs. So the activities or the medical reasons which could cause all of this is if you're straining too much to urinate because of some bladder condition, if you're straining too much to pass motion, if you have chronic constipation for very long and you're putting too much stress on your abdominal muscles. Third, if you've had a persistent cough for months or years together, which is putting too much pressure on your abdomen. It could be because of pregnancy, it could be because of being overweight or obese, it could be because you're suddenly tried to lift a very heavy object, or you're into strenuous exercises, and also because of poor nutrition and smoking. Coming to the symptoms of hernia, so in most cases it is not really a problem. You will just have a painless swelling which you will feel in the abdominal cavity. It will not cause any trouble in your day-to-day activities. But in some cases, people have a dull, persistent pain throughout the day, or they might have a lot of pain and discomfort when they're standing up from a seated position, or standing for long periods, or trying to lift any weight from the ground, or pushing or pulling any object. That is when the pain starts to begin. So if that is your problem, you should consult a general physician who can tell you to refer to a physiotherapist who can teach you a few exercises. So the first exercise is your diaphragmatic and abdominal breathing. So for this one, you will lie down flat on your back, keep one hand on your chest, one hand on your stomach, and take a deep breath in. For the first breath, you will try to enlarge your chest as much as you can. So never hold your breath, just a deep breath in and then a deep breath out. For the second breath, you will try to fill air in your abdomen. So make it feel like a balloon and take a deep breath in. So you repeat this cycle 10 times for the chest and 10 times for the abdomen, but do not hold your breath. So the next exercise are pelvic tilts. So you will start with anterior and posterior pelvic tilts. When you do an anterior tilt, you will try to arch your back, okay? Bring it up from the floor. Hold this for 5 counts, but do not hold your breath. Just hold the position for 5 counts and then try and flatten your back as much as you can to the ground. And then up again. And then down. And repeat this 10 to 15 times and do 2 to 3 sets of this exercise. So the next exercise is known as knee openers. So you will start with both your knees bent and your feet flat on the ground. You can start with a single knee first. Okay, so you will open it up completely without rotating your body. So your pelvis is in contact with the ground. You're just taking the knee out. If you're not able to touch the ground, that is okay, as much as possible. Then back up and do it for the other side. And back up. So 10 times on the left, 10 times on the right. You can do 2 to 3 sets of this exercise. The next one is a butterfly stretch, which is just a modification of the knee opener. So instead of going one by one on the left and right, you open both your knees together at the same time. Bring your feet together and go as down as you can. And then try to hold this position for at least 10 to 15 seconds. So this will stretch your inguinal as well as your abdominal area. This will help in stimulating your abdominal muscles. So hold this, but do not hold your breath. Once you're done with 10 to 15 seconds, bring it back up. Do this around 10 to 15 times, 2 to 3 sets. So once you're comfortable doing the knee openers and the butterfly stretch in your normal lying position, you can progress to doing a bridge. Okay, you lift your hip up, hands by your sides, and do the same exercise. So you'll start with the knee opener, take your knee out as much as you can, and then back up on the left. Do the same thing on the right, and up. At any point, if you feel a strain or your abdominal muscle working too much, go down and do it in this position. If you're comfortable, up, left and right. 10 times on each side, 2 to 3 sets. Once you're comfortable doing the butterfly stretch in the lying down position, you can progress this also by doing it in bridging. So you come up, hands by the side, and open both your legs together at the same time. Try to hold this position for 10 seconds and then back. Again, open, try to hold for 10 seconds and back. You can do this 10 times for 2 to 3 sets, but do not hold your breath when you're going up in the bridging position. So the next one is your lower body rotation. You will start with your arms by the side of your head and you will rotate both your knees to one side. Try not to rotate your upper body, just the lower body. Maintain this position for around 15 to 20 seconds till you feel a stretch in your abdominal muscles. Then to the opposite side. Do not hold your breath when you're doing this exercise. Okay, you can repeat it 10 times on each side and do 2 to 3 sets. So the next exercise is a pillow squeeze. So you lie down, you keep a pillow between both your knees. Okay, hands by the side of the body and just squeeze the pillow with your knees. Try to hold this for 5 seconds in the beginning. Once you're comfortable, hold it for 10 to 15 seconds. Do not hold your breath, just squeeze and then relax. And then squeeze again and relax. You can do this 10 times, 2 to 3 sets. Once you're very comfortable with this exercise, you can progress this by bridging. So you come up and then you press. Again, do not hold your breath. Hold it for around 5 to 10 seconds and then relax. You can come down, up, squeeze, hold and relax. Again, you can do this 10 times, so 2 to 3 sets. The next exercise is called bird dog. So here you will be on your hands and knees. Hands just below the shoulder, knees just below the hip, and you will alternate between your hand and leg. So if your left hand goes up, your right leg goes up. Try to hold this for 5 seconds while you continue to breathe, and then back. Alternate, right hand up, left leg up, back. Try to keep your spine neutral when you're doing this and your core tight. You have to repeat it 10 times on each side. You can do 2 to 3 sets. So the next exercise is a wall squat. So you will place your feet at a little distance from the floor, hands in front of you, and your back has to be completely in contact with the wall. You'll go down as if you're sitting on a chair. Try to go only 90 degrees and then come back up, down, up. So the first few days you can do it without any hold. Eventually you can go down, hold for 5 to 10 seconds and then come back up. Do not do normal squats because that puts a lot of pressure in your abdomen. So practice these for at least a couple of weeks. Once you feel like you're doing this okay, you can attempt to do normal squats. Before doing any of these exercises, please take a few precautions. Do not do any flexion based exercises, that is bending forward. So anything like crunches or sit-ups, please avoid that at least in the initial stages. Once you have done these exercises and built up your muscle strength, you could progress to those. Avoid pushing or pulling heavy weights or lifting heavy weights off the ground, at least when you've started these exercises. Do not perform any exercise while you're holding your breath because that is causing a lot of pressure on your abdominal muscles. So just keep breathing normally. Before starting any of these exercises, please consult your doctor. If you are doing these exercises and you feel excessive strain or you feel like your symptoms are worsening, please meet your doctor once. At any point, if you feel like the pain is increasing, stop doing these exercises because we do not want to increase your abdominal pressure even more. Please do start doing these exercises at home. If you have any doubt, ask us in the comment section below. Like, share and subscribe to our channel, and please witness your fitness with us.